Achilles tendonitis is inflammation around the Achilles tendon. Achilles is in the back of the ankle. It's the big thick tendon that most of us can feel, and it extends from the heel and goes up the lower leg. No one knows for sure. It's often thought to be activity related, and oftentimes people will get inflammations and onset of the pain after becoming more active or changing their activities. But sometimes people will develop Achilles tendonitis with no particular etiology at all. It's diagnosed mainly by history and exam, like most things in orthopedic foot and ankle problems. So patients will complain of pain in the location of their Achilles. It's usually worsened with activities. Sometimes they'll have some improvement if they use it a little bit as the tendon warms up. On examination, oftentimes they'll be tender right along the Achilles tendon. Some people will have a little bit of swelling or bogginess around the tendon. Well, like most problems, we usually try non-surgical treatment first, and oftentimes that's successful. The non-surgical treatment usually involves some attempts at quieting down the inflammation, and that can be using anti-inflammatory pills like over-the-counter Advil, Motrin. Other anti-inflammatories can be applied topically in creams. Using things like a heel wedge in the shoe to take some of the tension off the tendon can be helpful. And for more aggressive quieting down, we may consider immobilizing a patient in a cast or a fracture boot. If all of the non-surgical options fail, and the other one that I failed to mention were things like physical therapy, then surgery can vary depending on what's found at the time of surgery. If it's just inflammation, then the surgery would involve removing the inflamed tissue around the tendon. If the process is advanced and there's some wear and tear in the tendon, then the surgery may also involve removing the affected portion of the tendon. And it's variable depending on how advanced the inflammation or tendonitis is and exactly what has to be done at the time of surgery. But Achilles problems tend to take a while to recover from. And even though the surgery can be relatively uncomplicated, the full recovery can easily take up to 6 months. Like most problems, if it affects your pain and your function, then it's going to be a bother. And Achilles tendonitis certainly can affect people's lifestyles. So, the good news about Achilles tendonitis is it's usually something that will go away and can be treated non-surgically.